In the previous session, we completed the second part of connective tissue, that is extracellular matrix. In this session, I'll be discussing on types of connective tissue. Different types of connective tissue are found in different parts of the body according to the local structure and functional requirements. It can be classified based on structure and function. Structurally, it is classified based on the predominance of the cell type and its arrangement, concentration and arrangement of fiber type and character of ground substance. They are broadly classified into connective tissue proper, specialized connective tissue, that is cartilage and bone, embryonic connective tissue, that is stem cells. Functionally, connective tissue is classified based on local functional requirements into areolar tissue, adipose tissue, white fibrous tissue, elastic tissue, reticular tissue, mucoid tissue, and neuroglia may also be considered as special type of connective tissue in central nervous system. Connective tissue proper includes those connective tissues in which fibrous component is predominant. Connective tissue proper is classified into loose connective tissue and dense connective tissue, which is further subclassified into regular and irregular dense connective tissue. Loose connective tissue or loose areolar tissue. This is a diagrammatic representation of loose areolar tissue. Loose connective tissue is very common, seen in almost all parts of the body, is flexible, not very resistant to stress, supports epithelial tissue, fills the spaces between muscle and nerve fibers. It appears in those areas where considerable amount of mobility is required. Loose connective tissue contains cells, fibers, and ground substance in equal parts. Most numerous cells observed are fibroblasts. Other connective tissue cells like adipose cells, mast cells, macrophages are also present along with blood vessels and nerves. In the fibers, collagen is the most abundant than elastic and reticular fibers. Ground substance is present in moderate amounts. Loose areolar tissue gets distorted easily. Hence, it allows the tissue to move freely. It is avascular tissue. Metabolites and oxygen diffuse through it to the epithelium. Example where diffusion occurs is lamina propria and submucosa of various systems and hypodermis of the skin. Dense connective tissue. It is also called white fibrous tissue since it appears white when seen in naked eye. Dense connective tissue is adapted to offer stress resistance, that is tensile strength to the tissue, which means it is less flexible and more resistant to stress. It also offers protection to the underlying tissue. It is composed of few cells, more collagen fibers, and less ground substance. Based on the orientation and arrangement of the collagen fibers, it is classified into two types, dense regular and dense irregular connective tissues. Dense regular connective tissue. This is a picture of the section of tendon, which is an example of dense regular connective tissue. The connective tissue is arranged in a definite pattern. Type 1 collagen fibers are densely packed, aligned uniformly and parallel to each other in the form of bundles. Abundant fibroblasts are aligned parallel to the fibers. Example for dense regular connective tissue is tendon, which holds the muscle to the bone. Ligament, which holds the two bones together near the joint. The uniform alignment helps in transferring mechanical force between two structures. Tendons. The picture is longitudinal section of the tendon. Tendons are composed predominantly of collagen fibers that run parallel to each other. The fibers are arranged in the form of bundles. These bundles are united by areolar tissue, which contains numerous fibroblasts. In longitudinal sections, through a tendon, the fibroblasts and their nuclei are seen to be elongated and are arranged in single rows. In transverse sections, the fibroblasts are stellate in shape because of wing-like processes. The functions of tendon is to concentrate the pull of a muscle on a relatively small area of bone. By curving around bony pulleys or under reticula, they allow alterations in the direction of pull. Tendons also allow the muscle mass to be placed at a convenient distance away from its site of action. Ligaments. Ligaments are fibrous bands which connect the adjacent bones, forming integral parts of the joints. They are tough and unyielding, but at the same time are flexible and pliant, so that normal movements can occur without any resistance, but the abnormal movements are prevented. Coming to the types of ligaments, according to the composition, ligaments are made up of collagen fibers. These are inelastic and unstretchable. Most of the ligaments are this type. A few ligaments are made up of elastic fibers. These are elastic and stretchable. Examples are ligament of flava and ligaments of auditory ossicles. According to the relation to the joint, it is classified into intrinsic ligaments, which surround the joint and may be intracapsular. Extrinsic ligaments are independent of the joint and lie little away from the joint. According to the morphology, the ligaments in same areas are considered as degenerated tendons of the related muscles. Examples: tibial collateral ligament is degenerated tendon of adductor magnus muscle. Sacrotuberous ligament is degenerated tendon of long head of biceps femoris. Sacrospinous ligament is degenerated part of coccygeus muscle. Long plantar ligament is part of peroneus longus muscle. Coming to the raphe. Raphe is a linear fibrous band formed by interdigitation of the tendinous or aponeurotic ends of muscles. It differs from a ligament in that it is stretchable, but raphe is non-stretchable. Examples where raphe is located are linea alba, pterygomandibular raphe, mylohyoid raphe, pharyngeal raphe, and coccygeal raphe. Coming to the second type of the dense connective tissue, that is the dense irregular connective tissue. In dense irregular connective tissue, collagen fibers are arranged irregularly, which can be observed in this picture. The bundles of collagen are randomly interwoven with no definite orientation. It provides resistance to mechanical stress from all directions. Dense irregular connective tissue is present in a reticular layer of dermis connective tissue sheath of muscles and nerves, capsules of glands, sclera, periosteum, adventitia of blood vessels, and submucosa of gastrointestinal tract. Now coming to the connective tissue with special properties. Elastic tissue is a specialized dense connective tissue predominantly formed by elastic fibers. It is yellow in color in contrast to fibrous tissue which appears white. They can be present in various ways in the form of cords or thickened ligaments, membranes or sheets. Examples where elastic tissue is located are in the form of ligaments. It is seen in the ligamentum nuchae, ligamenta flava, and vocal ligaments. Some are numerous in the form of membranes that are required to stretch periodically, like the deeper layer of superficial fascia covering the anterior abdominal wall to allow distension of the abdomen. Some fibers may fuse with each other to form sheets which are fenestrated, called as elastic lamellae in the walls of large arteries and as internal elastic lamina in small blood vessels. Elastic tissue is also located in mucous membrane of trachea, bronchi, and lung alveoli. Now do not confuse the elastic tissue with the elastic fibers. Elastic fibers are single fibers. Elastic tissue is the aggregation of the elastic fibers, either in the form of cords, membranes, or sheets. Clear? Now coming to the other type of specialized connective tissue, that is the reticular tissue. Reticular tissue is loose connective tissue made up of reticular fibers or type 3 collagen fibers and reticular cells. Reticular cells are nothing but modified fibroblasts. Type 3 collagen fibers form delicate network that supports various types of cells. Most of the cells are fibroblasts, but some may be macrophages. Examples where reticular tissue is located are lymph nodes, glands, bone marrow, spleen, liver, kidney, and lungs. Coming to the other type of specialized form of connective tissue, mucoid tissue or embryonic connective tissue. In contrast to all the connective tissues, the most conspicuous component of mucoid tissue is a jelly-like ground substance which is abundant and rich in hyaluronic acid. Scattered through this ground substance, there are star-shaped fibroblasts with branching processes, some delicate collagen fibers, and also some rounded cells. This kind of tissue is found in the umbilical cord, which is called Wharton's jelly, vitreous body of the eyeball, and pulp of developing tooth. Now, let us see how this classification has occurred and embryologically how it is derived. As seen in the table, all connective tissue components are derived from one origin, that is the mesenchyme or mesenchymal cells. Mesenchyme differentiates into fibroblasts, chondroblast, osteoblast, and hematopoietic cells. Fibroblast gives rise to connective tissue proper and its subclasses like connective tissue proper, loose connective tissue, and dense connective tissue. Now, loose connective tissue is further divided into areolar tissue, adipose, and reticular tissue. Dense connective tissue is further classified into regular, irregular, and elastic tissue. Chondroblast gives rise to different types of cartilages like hyaline cartilage, fibrocartilage, and elastic cartilage. Osteoblast gives rise to bony tissues. Okay, and further it is subclassified into compact bone and spongy bone. And hematopoietic stem cells gives rise to or form the blood components. Till now, we discussed about the connective tissue, which included the composition, various types of connective tissues like embryonic connective tissue proper with loose areolar and dense connective tissue and its two types, regular and irregular, along with the examples. Okay. See you in the next session with clinical aspects of the connective tissue.